Namaste. Namaste, everyone.
Namaste.
Thank you so much for joining today. This is the second sort of episode of Chai Pe Science in a rather different vein from last week's one, which was on quantum mechanics. Today we're looking at something really sort of hot off the press, really contemporary, and that is the response to COVID-19, looking at how it's been in the UK versus in India. But just before we begin, just a quick reminder to please subscribe to my channel, English Bahen Kadilse, and to follow me on Twitter at English_Bahen, and also for our guest as well, Vidyasagar Sir, Distinguished Professor Vidyasagar Sir. He's on Twitter. Please go follow him at Stellensatz. That's spelled STELLENSATZ. So please go and follow him as well. So yes, onto a very topical subject, which is COVID-19. Now, the reason why I felt it was about time to do a session on this is because before the coronavirus outbreak, there was the Global Health Security Index created at the end of 2019, where 195 countries from across the world were ranked by their ability to prevent, to detect, and to respond to an infectious disease. And at that time, at the tail end of 2019, the UK was ranked second, and India was ranked 57th. So that's the background to before the outbreak. Then obviously the outbreak has occurred, and we now see the results of just how different countries have been able to react to this infectious disease of COVID-19, where today, on the 9th of January, we have the figures that in the UK, there have been 1,178 deaths per million, compared to 110 deaths per million in India. So you can see a very massive difference there. It's over a factor of 10. And in the UK, things are really bad actually right now. So there have been 80,000 deaths in our population of 60 million, so 6 crore, which ranks us 7th globally in terms of number of deaths, for such a small country. So what I'm hoping to get out of today is to be reflecting with Sir on some of the policy decisions that have been made in the two countries, to be looking at the scientific approaches made in the two countries. And I'm actually very interested in the civilizational and the social differences between the two countries. Maybe some of these are the reasons why there has been such a difference in outcome to corona in the two countries. So first of all, I just want to put my personal perspectives across. So as I just mentioned, things are really bad in the UK right now. Yesterday, there were 1,350 deaths, which is the highest number of deaths that have been throughout the whole pandemic. Apparently, in some areas of London, 1 in 15 people are thought to have COVID-19 right now. It's been declared a major incident in many areas of the country. The hospitals just can't cope. And obviously, the mutation that's occurred in the UK has created that situation to some extent. But there have also been other reasons and other conditions and factors that have fed into this situation of it being so bad in the UK right now. And so when I reflect on how things are when the corona pandemic first broke out, so back in February, March time, my husband and I were actually traveling back from India at that very time. So we got to have like a direct comparison between how things were going in India and in the UK. And some of the observations I made is that firstly, India was so quick to respond. So when we arrived already in India, and this was before much was known about COVID-19 at all, right at the beginning of March, already we were being having our temperature taken at the airports, in the hotels. So India was responding very rapidly. People were wearing masks in the airport. Everyone was wearing a mask. And that compares to then when we landed in the UK in mid-March, where in Heathrow Airport in London, nobody was wearing a mask and nobody was checking our temperature. So that was a very clear difference to me as just to how seriously India was taking the pandemic at that time, when the UK was kind of in this confused state. It didn't seem like they really knew what to do. And I think that's been a fair description of how it's been since that outbreak, because in the UK, policy has switched around so frequently. One day you've got a lot of freedom, and then the next day you're in total lockdown. And there have been many incidences where the Prime Minister has promised that children will be going to school the next day or whatever, and then that same day he's then turned around and said the complete opposite. No, we have to lock down. So it's been a very confused approach, and I think that is one of the reasons personally why things haven't been so bad in the UK, because people don't really know what to do. They're being told everything's okay one day and then things really aren't okay the next day. Whereas in India, the response to me has seemed to be very much more coordinated, much more clear, much more committed. And there have been, Modi ji, he has thought up some really clever ways to create cohesion in the society, banging the button, the kitchen utensils, and in all these ways, uniting India as what I have seen. So then looking at how people on the ground have been responding, it's been clear again that India was very open to the idea of wearing masks, changing their diet, and just doing whatever they can to protect themselves from COVID-19, or to give themselves the best fighting chance to fight against COVID-19 if they do catch it. Whereas in the UK, people haven't really known what to do. There's not been any advice really, other than staying away from other people. It kind of left people feeling like they weren't empowered to kind of do what they can to protect themselves. So a final way in which I just want to draw a comparison is that in India, I felt that the people, my friends and the family in India, they managed through the pandemic, through the lockdowns, a lot better than my friends and family in the UK. And I credit a lot of that to the fact that, in that first lockdown, that they were streaming things like Ramayan and Mahabharat on the TV, and everyone again was uniting and, returning to their roots and returning to everything that is great about their culture in order to get through this difficult time, in comparison to in the UK, where again people were left without any advice, any guidance on what they themselves can do, and then just listening to conflicting messages from the media and etc. And the response I felt was that in the UK, their mental health suffered a lot. And in fact, the government poured millions of pounds into trying to get mental health services to people in their homes. And in my professional capacity, I was sort of involved in some of that, trying to get availability of mental health services to people in the community. But in India, streaming the Ramayan series, streaming the Mahabharat, to me, that seemed much more effective. So these are just some of the personal reflections, observations I've made comparing how it's been in India to in the UK during the pandemic. So what I'm going to do now is I'm going to welcome Vidyasagar ji. He's a distinguished professor at IIT Hyderabad. He is a leading control theorist, which means that his research has been primarily in the area of control of dynamical systems. in machines and engineering applications. And from this, he has written 11 books. He's been co-authored in more than 450 papers. And here you can really see his repertoire of expertise, because it's everything from feedback systems to robot dynamics to artificial intelligence and neural networks. And more recently, I see into sort of biological applications such as computational modeling of cancer and that sort of thing. So he's a fellow of the Royal Society of Science, and he is also, and the main reason we're inviting him onto this channel today, he is the chair of the COVID-19 Supermodel committee. So the committee that was responsible for modeling the growth, the spread of COVID-19 in India, and particularly for then making recommendations off the back of those models as to help India prepare for the pandemic, to get all of its infrastructure in place, to get the beds ready, to get the ventilators ready, and all these sort of real practical issues that need to be faced to make sure that India came through the pandemic in the best way. So welcome, Vidyasagar ji. Namaste. Aap kaise ho?
ठीक है.
Perfect. Well, thank you so much again for joining us today. So we really are very grateful for having you on here. I really want to start by thinking through some of the introductions to how this all came about, this supermodeling committee, that sort of thing. Because as we'll touch on much later, India has probably the oldest and the most critical contribution to maths globally. And I'll be talking hopefully a bit later about the Kerala School of Mathematics and India's heritage in maths. Because ultimately, maths is the fundamental language of the universe. It reflects all the patterns within nature, and it's the basis of physics and all the other sciences. So, India has such a tradition in this, and here we have in yourself, one of the most eminent scientists, mathematicians that India has produced. So now focusing on to the modeling that you have been doing on the COVID-19 pandemic. So I was thinking we'd start maybe by just talking through the very basics of these epidemiological models, and which I understand have led to 2 peer-reviewed publications, so people can go and find those for themselves. And just for my very, very layman's perspective, although I do have a PhD in statistics, compared to the expertise you have, my knowledge is quite limited. So I understand that the models you created are based on the traditional SIR model, where S stands for the susceptible population within India to COVID-19. And there you can split those into the susceptible people who would then become asymptomatic versus those who would become, who would have symptoms. The I in that model is for then the infected population, so modeling how they evolve. And again, you have asymptomatic infected people and then symptomatic infected people. And finally, the R stands for removed or recovered, I guess you could also say, although some of the people obviously don't recover. So some of those symptomatic people, they actually go on and they die, so they become the deceased population. So that's the basis for this model: symptomatic, infected, removed, modeling the whole population in India with a bunch of assumptions there, leading to 7 equations with 4 parameters, with one of the parameters being beta, which is the probability of transmitting infection between people, gamma being the removal rate from people as they recover, nu being the death rate, and finally epsilon being the rate of infected people to the total population. So Vidyasagar ji, I would be really grateful, now that hopefully that sets the context of what the basics of the model is, just to hear from you, in your words, what is the model, how has it performed in terms of its accuracy, it's the validity of its assumptions, and importantly, like the ability to validate it because of the availability of any data that have been provided from the government on a daily basis, for example.
Yeah, thank you very much. So I just wanted to say that the model you described is what we were using in October. We have moved a little bit beyond that. Now we have come out with a new acronym, which we call as Sutra, S-U-T-R-A. Okay. So here S stands for the susceptible population, which is the standard assumption in epidemic modeling. The U stands for undetected people. That means people who are asymptomatic, but they have never been tested. So, and because they don't show symptoms, you don't know who they are. T stands for the tested population. And the tested population is in two kinds. In India now, for the past several months, amongst the people who test positive, the people who test negative, you're not bothered about them. They just go back to their houses. But among the people who test positive, only around 15% require any kind of a hospital care or medical follow-up. So 85% of the people who test positive are either asymptomatic or they're mild. So they're told to just go home and isolate themselves. Okay. The ones who actually show symptoms, they are in a hospital or some kind of a healthcare facility. They are in fact quarantined so they do not spread the disease further. On the other hand, those who test positive but are asymptomatic, they're told to go back and quarantine themselves. But how sincerely they follow these instructions, nobody knows. We suspect not very well. And then there's this group which we're calling U, which is the untested, undetected people. And they're unwittingly spreading the disease because even they themselves do not know that they are infected. So the improvement we made was to segregate the asymptomatic people to those who are tested and found to be asymptomatic and those who are not tested at all. Okay. And R, as you correctly explained, stands for removed. The overwhelming majority of them are actually recovered. We have one of the lowest case fatality rates in India. For every 100 people who enter the hospital who are testing positive, only 1.5% pass away. And that percentage is falling. Now it is something like 1.2, 1.3%. Therefore, if you are detected positive for the coronavirus, your chances of survival are somewhere around 98.5 to 99%. I mention this because very early in the pandemic, one of my friends who runs a diagnostic clinic here in Hyderabad, he told me that one lady had come and given her sample, the saliva sample, and then when she came back a couple of days later, she was told that she was corona positive and she fainted. She was so scared. But there's no reason for that at all because the likelihood of somebody actually dying from this disease is very low. As you have correctly pointed out, our death rate per million population is about 110, about 1/10 of the rate of the UK, USA, Italy, Spain. All these countries are 10 times worse off compared to ours. And the last A in Sutra is for approach. So susceptible, undetected, tested, and recovered approach. So we're calling it a Sutra. And then we recalibrated this model based on the Indian data. And the good thing is that the predictions that we made back in September are still holding up very well. So we actually made these predictions in the middle of September, which was actually the worst period for the Indian pandemic. We hit our peak at that time. We had 97,000 new cases in September. That was our single day record. Okay. That was the time at which we predicted this is it, this is the peak. It's not going to get any worse. So we really wanted permission to go live with our predictions and tell the general public that this is our prediction, so relax. But we did not get that permission. Government bureaucracy takes a long time. So we took around 4 weeks before we could get that permission. So we went public on the 18th of October. We had a press conference. By then, every Tom, Dick, and Harry had figured out that the peak was past because the number of daily cases had dropped down from 97,000 to 62,000. So it was a very sharp peak. So the interesting thing is that there was a lot of fear mongering even after that. People were saying, what happens with the festivals? I mean, people are not going to be following guidelines. There's going to be a second wave, third wave, fourth wave, and all kinds of things like that. Interestingly, none of these things have come to pass. If you think your readership, your viewership would be interested, I can share with you the trajectory of the Indian pandemic and also the predictions and how they're holding now. So if you're okay with that, let me just see if I can. Let me just do this. Okay, just 1 minute. I'll first get the picture onto my computer so that we're not wasting a lot of time for me to look for the picture. Okay, so now I can share the screen and an application window. And let's see here. I think this is the right picture. Okay. So let's just put it in the presentation mode so you can see it. So now you see this big picture, I hope. Can you see it?
Yes. Yeah.
So now this blue curve is the actual number of active infections in India. And the saffron curve is the output of our model. And this is what I was mentioning. If you see there, that towards the middle of September, that's when our model predicted that the peak would be. And the actual peak was a few days earlier, around 17th of September. And as I mentioned, we were not really allowed to go public at that point. We went public around there, around the 18th of October, by which time the downward trend was very obvious. Now, if you keep following, we haven't really changed the model very much. And you can see the blue curve continues to track our predictions very well. There is a little bump there that you can call the post-Diwali bump. You can see the date here, right around the end of November. But very quickly, it again fell below the saffron curve. So our predictions are, if you see here, by the end of February of this year, the total number of cases would be extremely low, something of the order of 30, 40,000, that is active infections. And the number of daily cases should be of the order of 3,000, 4,000 maximum, even fewer than that. And at that point, the pandemic is manageable. You cannot say over because nothing is over unless you have 0 cases, but it is certainly very manageable. So I will stop sharing, but I just want to highlight the precision with which the blue curve, which is the actual data, is being tracked by the saffron curve, which is the output of our model. Okay. So now we're back live, I guess.
Excellent. Thank you. Perfect. So it really is quite amazing how close the prediction was to then what happened. When I reflect on the models that I have seen in the UK, where they themselves would, they'd have a discrepancy almost of an order of magnitude between them, and the reality was often somewhere in the middle. So, I mean, perhaps you could just reflect on why you feel your models were able to be so accurate? Was it the availability of data? Was that what it was, or?
No, it is not. So you see, what happens is that a lot of the, well, okay, I will use a couple of technical terms which I hope people don't mind. Many of the people who call themselves modelers, they do what is called time series analysis. What they're doing is just taking the data and making a very short term 10-15 days look ahead prediction. And when you do that, those predictions will not last 3 months, 4 months like our predictions have lasted. What we have is called a dynamical systems model or a differential equations model. So in the differential equations model, the total number of parameters is 6. You said it was 4, and it was in October. We updated it now to make it 6 because we discovered a new parameter called reach. If you are interested, I will explain it later, but this is not the time. But the fact that we're using a differential equation model instead of a time series model is why our predictions have been very faithful. The availability of data in India is not, repeat, not any more reliable than anywhere else. We kind of take it whenever it comes. Most of the data is crowdsourced. So it has got all the uncertainties and ambiguities and inaccuracies that any crowdsourced effort would have. But the fact is that the predictions have held up extremely well. Now, I have not shown you the predictions for individual states because that will be a little bit overwhelming. But we have actually done predictions for all the states and a few of the union territories, the big ones. Not little ones, but the big union territories we have done. And there again, we were able to catch the trend pretty accurately. Okay. The other thing, if I may, I would like to point out, this was part of the charter of our committee. Our committee was set up on the 17th of May. And we were supposed to come out with not just a model for the progression of the disease, but also, if possible, make an assessment of the impact of the non-pharmaceutical interventions, like the lockdown. So what we did there was, we took the data from the 1st of March till the end of March, those 30 days time. That's when the pandemic was really out of control. If you look at the data, the absolute numbers are very small. So they mask how badly the disease was progressing. What you really have to do is to plot the number of cases on a logarithmic scale, and you see how quickly the number of cases was doubling. That is what gives you the indication of the growth of the pandemic. And during that period, the number of cases was doubling every 4 days, which is a shockingly fast rate of growth. Okay. So then what we did was we took our model and fed in the parameters of the pandemic as they were pre-lockdown, and then figured out what the progression of the pandemic would have been, a kind of a counterfactual scenario. And then we compared it with what actually happened. And the difference is again very dramatic. And again, with your permission, I would like to share it with your viewership. So let me just once again yeah. So let me just go back again.
And just while Vidyasagar ji is doing that, just to make the point that the statistician George Box famously said, models are wrong, but some are useful. But I must admit, looking at his models, I can't say that they look too wrong, actually. They look quite correct.
No, that is a famous saying of George Box, which is often misunderstood. And since your PhD is in statistics, you would have had the same experience I have, which is that when you talk about the box method, it's not a what, it is a who. So people always need to be reminded of that. So this curve is very interesting. So this is, as you can see, it is called lockdown alternatives, active infection. The yellow curve is what actually happened. You can see the peak is around the middle of September, okay? And the peak infections are around 10 lakhs. And then it started going down. The red curve is the projection if there had been no lockdown. And you can see the peak would have been, you can see there, something of 140 to 150 lakhs. That is 1.4 to 1.6, 1.5 crores. And the peak would have come not in the middle of September, but somewhere near the end of June, end of May, beginning of June, middle of June, that kind of time frame. So this would have been devastating for India for a couple of reasons. First of all, India simply would not have been able to cope with 1.5 crore active cases at one time. Impossible. And secondly, in terms of our preparedness, I will again stop sharing. In terms of our preparedness, whether it is masks or PPE or ventilators, ICU beds, we were not in good shape in March, April timeframe. But Indian ingenuity came to the fore, and we made very rapid progress. And from having to import these PPE kits, now India is the largest producer of PPE kits in the world outside China. So not only are we self-sufficient, we can even export. So the lockdown gave us that very, very crucial 3-4 months window that we could use to prepare ourselves better. So people keep saying, has India flattened the curve? I think I just showed you that it did flatten the curve. It reduced the peak value by a factor of 14 and pushed the peak out in time by about 4 months. So those 4 months gave us the time to prepare, and the number of cases with which we had to cope also reduced quite dramatically.
Fantastic. What a success story, in my opinion, that the whole world should know about. And it's so sad when you read the papers, they only ever seem to pick up and try and make India look out to be really bad. When in fact, we've just seen before our eyes that flattening of the curve being just so extreme. Whereas, I'm sure there's been flattening of the curve in the UK, but it's not been to that extent, has it? So I'm wondering if we might just probe into that a bit more. To understand about differences between countries. So I understand you mentioned about crowdsourcing the data in India, but I remember on a previous call you mentioned to me that in the UK there are no recovery figures that are published. So it makes it difficult to then predict what are the active cases, and that might be quite frustrating, not just for the UK but for other countries when they're trying to understand the impacts of the new strain, the mutation of the coronavirus in the UK, how that's going to then impact on other countries such as India. If you haven't got all the data, you can't do such a complete model, can you? Or such an accurate model. There'll be much higher confidence greater confidence intervals around any predictions. So perhaps you could just comment about, the availability of data or things that you feel that India has done really well in doing that maybe other countries could learn from.
So at the start of the pandemic, we were talking about March, April, that kind of a time frame, possibly even early March. There were two countries that made a conscious decision that they would go for what they called herd immunity. Basically, they felt that this pandemic was very harmless and that they should just let it sweep through the country. It will make one round around the country. Everybody will get antibodies and we can all relax. So two countries did that. One country was the UK. Your chief scientific advisor, in fact, advocated herd immunity. And the other country which did that, you may or may not recall, was Sweden. And the interesting thing about Swedish data is, other than the UK, Sweden is the only other country that does not publish recovery figures. And I'll tell you a very interesting fact. If you go to April, May, that kind of a time interval, India had, and has had for many months now, we have had the highest ratio between recoveries to deaths. I just mentioned that in India, 98.5% people recover, which means approximately 50 recoveries for every death. So in the start of the pandemic, we didn't really have our act together. So we had 4 recoveries for every death. But at that point in the world, it was still the highest. Other countries had 2 recoveries per death. We had 4 per death. Sweden had 3 deaths per recovery. So, so then this figure was so embarrassing that they stopped publishing recovery figures. It was just to save themselves some embarrassment, really. So even today, you don't have recovery figures for Sweden. And then the point you made that you see the total number of daily new cases is not a good measure. It's highly erratic. But the number of active cases is a much smoother total. So if you're going to model, you need the number of active cases. So how do you get the active cases? You keep adding the daily new cases, and then you subtract the recoveries. That's what gives you the number of active cases. Now, with the number of daily new cases, people like me can figure out how many people have got sick, but we can't subtract the recoveries because we don't know how many there are. So it is actually not a good approach to assist modelers by withholding the recovery data. The other point I wish to make is to reinforce something you said in the beginning, which is a lot of changes in policy in terms of do we want lockdown, do we want schools, do we not want schools, all this kind of thing. And UK is not the only one that has done that. USA probably has had even more U-turns than the UK, but it doesn't help. I actually was talking to one UK-based professor, and he was saying that he was trying to study the impact of what he called 2 days on, 1 day off lockdown. So that is lockdown for 2 days, take it off for 1 day. And I told him, this makes no sense. See, a pandemic is not a finely tuned race car that you just put on your foot on the gas, it speeds up, take your foot off, it slows down. I said, think of an oil tanker. I mean, the captain turns the wheel, and half an hour later, finally the ship starts turning. And the pandemic is like that. You take a policy decision today, you will see the impact of that 2 weeks, 3 weeks, even a month later. So what does that tell you? It means that you have to be consistent in applying the policies. You can't be keeping on changing your policies based on very, very short-term observations. And this is something that our Indian government, specifically the Prime Minister, I gave him full credit for that, has been very consistent. First 6 weeks were very tough, very tight lockdown, and then slowly the things were relaxed. So now I think people have internalized all the things that you were mentioning earlier, the wearing of masks, social distancing, things of this nature. Not everybody does it, of course, but I think enough people do it that we can slow down the pandemic. The point that you mentioned, with your permission again, I would like to talk about the cultural reasons. Well, of course, watching Ramayana and Mahabharata was very, very good for the soul, no question about it. But I also felt that Indians, by and large, were very sharing in that period, in the sense that the governments were supposed to take care of the migrant workers. Were told not to go home because interstate transportation was stopped, and even within the state, many states did not have bus services. So the central government told various state governments to take care of the migrant workers where they were. Some states did, and some states did not. And some states very shamelessly ditched their migrant laborers. I won't mention the names, but your viewers know who they are. So who came to their aid? It was just ordinary people. Ordinary people like us, and we're just middle class Indians. We went out and got little bags of groceries and just put them out there, and then people would come and take them. And we used to do this every second day or something like that. And I'm sure we're not unique. And then there were other people who would essentially solicit money through the internet, saying that we are willing to take the trouble of collecting groceries and distributing it to needy people. Just fund us. And we did. When we say, I mean, our family, of course, but many other families. So we all pitched in. There was this collective sense that we're all in it together. And those of us who are a little bit more fortunate than others, we have a need to share. That's definitely a very Indian trait. I see societies that are far more affluent than us are simply lacking this. So even such a simple thing like shortages, when the lockdown was first announced, different states had different rules. But here in Hyderabad, the state government of Telangana had a very interesting rule. I thought it was quite enforceable. They said that you can go 3 kilometers from your house, not farther than that. So how does anyone check? So if I drive out in my car, if a policeman stops me, he will say, show me your driver's license. So I do. So he knows where I live. And it's not that he's got a tape measure and is measuring 3 kilometers, but he knows approximately whether you're close to home or you're driving across town. So many of the pharmacies were rationing masks. They said no more than 2 masks per customer, like this. But this only lasted 10 days. After 10 days, there were so many indigenous solutions. There's an abundant supply of masks, not always of the best quality. And then over time, the quality kept improving. So today, there's no shortage. Things like sanitizer. Again, they were being rationed for about 10, 15 days. Now, you heard the stories in the US say that some fellow bought 76,000 bottles of sanitizer or something like that. That kind of thing didn't happen here. Primarily, I think, again, for cultural reasons. I think people did realize that they have to behave responsibly. And again, you touched on this in your introductory comments, that the Prime Minister made all of us realize that we're all in this together. Of course, these critics made fun of people banging drums or lighting candles and all that. But as a way of ensuring solidarity amongst the people, I thought it was really good. And then slowly that tapered off, in the sense that after about 3-4 weeks, everybody realized, fine, solidarity is good enough. Now we have to take more proactive measures. And that's when the easing of the lockdown started on May 18th. And things are, I would say, now under very good control. Schools in Hyderabad started about 3 weeks ago, but not universities just yet. That's kind of interesting. So that's part of the reason, I think, why we have come through a whole lot better. And if, again, with your permission, I'll follow up on another of your comments. The press for India, especially in the international outlets, has been uniformly bad. I guess people want to see what they want to see. But you go to any website, for example, any website that would compare the infection rates, deaths per million, tests per million, all those parameters, if you compare them side by side, it's pretty obvious that India has done remarkably well. There is a kind of a tendency to not give us the credit that is due to us. But I will say this much. I think the present generation of Indians, especially the young Indians, they're very self-confident. They don't care for the stamp of approval from somebody outside. They know if you're doing badly. And the flip side, of course, is if you are doing badly, they don't hesitate to criticize. I think both are very essential. So I'll stop there. I'm sure you have other questions.
Thank you very much, Vidyasagar ji. So just to pause one moment there, and just to remind the audience that please do be writing your questions in for us both. We'll be taking questions from you quite soon. So please, get typing away, think up some really good questions for us. But just, yes, to reflect on a few of those points that you just raised. So yes, as I introduced this whole session with, when before the pandemic broke out, the Global Health Security Index rated India as 57th and the UK as 2nd. And in fact, what they've done in that, some academics have basically plotted that index of that ranking of 195 companies against how they have actually performed during COVID-19, and they've found an inverse, like a negative correlation. So the countries they thought would do worse have actually done much better than the countries they thought would be very good. So number one was supposed to be the US, and number two was supposed to be the UK. And as we can see, these are some of the two worst performing countries during the pandemic. So a couple of other interesting points you picked up about, the UK's response initially was, this herd immunity idea, and that actually does feed into this sort of societal, cultural context that you're bringing up, because what that effectively meant, in my mind, is that the UK was willing sort of to almost sacrifice the very vulnerable people, because it was people in care homes, people with pre-existing conditions who died in the process of trying for the country to get herd immunity. So India, in my opinion, would never have chosen, never in a million of years would have chosen that approach, because it really respects, wisdom. It respects elderly people. It will never just sacrifice elderly people and vulnerable people. So there's a really clear contrast between the social cultural context in the two countries that I think doesn't get picked up on enough at all. So I just want to mention earlier about India having one of the highest recoveries per infection rate. So it's really interesting because there's actually a quite confusing statistic in the UK, which is that Indians, or people of, of a heritage from that area of the world, that they are much more likely to die from COVID-19 than a British, like a white British person. And it just shows that there's more to it than just genetics as to why India has got such a high recovery per infection. It's not just genetic. There's some other factors going on here, and it might be maybe something to do like diet, I'm wondering, or just the fact that, in the UK, there isn't much sunshine, perhaps, and perhaps because people in India, they have been sort of designed to be living in a sunny country. Maybe they suffer more greatly. So I wonder if you have any reflections on that sort of contradiction between how Indians fare in India versus how they fare in the West.
Yes, I saw that paper that came very, very early in the pandemic, which said that within the people who passed away in the UK, the people of Asian or Indian extraction had a higher mortality rate than the Caucasian people. I don't know if that continues to be true. I haven't followed it, to be very honest with you. Here, as you correctly pointed out, first of all, the sunshine, that makes a big difference. Second, we have what I'll call an outdoorsy style of living. You know very well, people keep their windows open until it really literally you have to close them either because it's too hot or too cold. So this keeps the air circulating, which is actually good for the avoidance of the pandemic. And this is also, I think, a part of the reason why in the villages, where people have a much more outdoor style of living, the pandemic hasn't hit them very hard. We know that pretty confidently, even though nobody will say that the healthcare facilities in the countryside are great. They're bad even by Indian standards, we know that. But if you look at the mortality rates, it's no great difference from the cities. the point you made about sacrificing old people, that's very true. Most Indian old people, even today, still live with their family. So that makes a big difference, I think, in terms of the psychological aspect. I think they're amongst the loved ones, which I think makes a difference. And also, the people are very, very extra cautious to make sure that they don't infect them. If you look at the countries that had a lot of deaths early in the pandemic, most notably Italy and Spain, many of them were of old people. And primarily they died because the emergency facilities were overwhelmed. And the doctors were essentially having to play God, trying to decide whom to revive and whom not to attempt to revive. Excuse me. And of course, we're all familiar with this situation in New York State, where the great governor of New York decided to put corona patients with non-corona patients in their old people's homes. You were talking about 1,000 deaths per million for UK and the US as a whole. Well, in New York State, it is 2,000. So definitely some very, very poor planning there. So I think these points all contributed to the recovery. Now, I should also point one more thing. The inverse correlation you mentioned between the so-called health security index and the actual performance, it's because many of the the countries that ranked poorly in the health security index were actually those that were less affluent. But they also are closer to the equator. They had the same kind of a sunny windows open type of a lifestyle. And you can see that almost all of them are doing way better than the colder European countries. Of course, the European countries have a higher per capita GDP and all those parameters. They're doing very poorly in the pandemic. Whereas many of the countries that have much lower GDP are actually doing far better. So this is a very strange disease. I cannot speak for other countries, but if I look at India, some of the other viruses that we've had floating around, they primarily afflicted the poorer segment of society. This is one of the few viruses, perhaps even the only one, where it is inversely, it is inverted. It is attacking the more affluent section of society more than it is attacking the poorer people. And possibly that's why the response has also been good. I do not know.
Fantastic. Okay, so yes, audience, thank you very much, Vidyasagar ji. Audience, please remember to keep writing your questions in. We'll be getting to them very soon. But just one last question from me. And this is a slightly curveball question now, because I want to step away from COVID-19 specifically and be thinking more about India and particularly the Hindu tradition and success in mathematics generally. So as I'll just tell you about in a moment, Hindus have a remarkable track record in making mathematical discoveries. And you know, in my mind, it's very clear that that comes because of the philosophical understanding or the philosophical approach and insights that Sanatana Dharma provides us with. And it also provides us with the freedom to always go out searching for the truth and to ask questions, which, you know, countries elsewhere in the world where they were sort of under the thumb of, you know, Abrahamic religions, which are very much by the book and you mustn't question and you must, you know, follow these commandments, they didn't have that freedom. So, you know, there was so much progress in India. So things like zero and the decimal point, you know, the decimal system are very well known, although maybe not nearly as well known as they really should be, and that they, you know, they came out of India and the significance of these discoveries. So I'll just give you a quick, you know, few minutes whirlwind tour of mathematics in India. So For thousands of years, there have been discoveries, and notably from Aryabhata. He set up the Aryabhata school of mathematics. We're talking about 500 AD at the time. And that really laid then some clear foundations for some subsequent scientists, mathematicians such as Bhaskara, and eventually Madhava. So he was really instrumental. He founded the Kerala School of Mathematics in 1350, based on the foundations of these earlier mathematicians and scientists. And it was Madhavaji who made great progress, particularly in areas of geometry and trigonometry. So the relationships between different lengths and angles in triangles, which then gives rise to periodic functions such as the sine function, the cosine function, the tangent function, which then is the basis of all of physics essentially, and all of the modern day gadgets and everything, technologies that we are using. And then he also made great strides in algebra, which is where you are using letters and symbols to generalize mathematics, so that you can be doing things like looking at vector mathematics, matrices, polynomials, and looking at generalizing from just adding one number to another to looking at modeling patterns generally. And finally then into calculus, which is the study of change. And we mentioned earlier how your models are differential equations. So this is calculus, and particularly his major discoveries were of what is now known as Taylor's series. So it's infinite series, particularly of the sine series, cosine, tangent, arctangent. And as I mentioned, these are key to a lot of the physics that we use today. And finally, pi. He was accurate in writing out the decimal places of the number pi to 11 decimal places. So this is in about 1350 AD. And it then led to great discoveries of some of his students down the hundreds of years afterwards. In the end, the last student to come out of the Kerala School of Mathematics was Sankara Varman in about the 1800s. He was the last one because very sadly, Tipu Sultan at that time had destroyed libraries, temples, the institutions, and he had to escape essentially to save his life. So such a tradition of maths has come out of India, and in fact, this is the maths that then travelled via the Arab routes and via Jesuit priests to the West, and was then rediscovered and given credit to people like Newton and Euler and Taylor and Pascal and Fermat. All of their discoveries were based on all the discoveries from Bhaskara and Madhava and all their students. And Newton himself, he actually there's a famous quote from him saying that he stands on the shoulders of giants, and those giants were Bharatiyas, they were Hindus, and it's just so sad that the world doesn't know this. So my question for you, please, Vidyasagar ji, is do you have any reflections on the tradition of mathematics in India, particularly from Hinduism, and particularly the relevance of that today and in the future as India is looking to become a superpower and to be a world leader in science and technology and artificial intelligence and all of that good stuff?
Yes, thank you. Well, that's a very nice summary you have given of the course of Hindu mathematics. I will only mention one name that you forgot, called Brahmagupta. So yeah, Aryabhatta was born in 476 approximately, and Bhaskara came around the year 1000. In between was Brahmagupta. Brahmagupta is traditionally thought to have been born in the year 613 AD. And nowadays, I think you say CE, Common Era. Now, the interesting thing about Brahmagupta, I have not found this in Bhaskara. I'm sorry, I keep saying Bhaskara. I have not found this in Aryabhatta's works. But Brahmagupta very explicitly says Vyakta Ganita and Avyakta Ganita. What does that mean? Vyakta Ganita is mathematics with numbers, and Avyakta Ganita is mathematics without numbers. So that is algebra. That is symbolic mathematics versus numerical mathematics. So he actually had the distinction in his mind about algebra, so to speak. Now, the word algebra is a European invention. And as you said rightly, many of the concepts were taken over, and the people who introduced them to Europe were given the credit, so to speak. But that's okay. I mean, in the sense that I think by now we're somewhat accustomed to not getting credit for that is rightfully due to us, whether it is inventing the place value notation or controlling coronavirus. That seems to be the story of Indians. So, in terms of the mathematical tradition, I think the religious rituals that people go through, and when I say rituals, I don't mean they're necessarily very formal ones, even just simply sitting and praying and meditating. They help people to focus on the abstract. And mathematics is the most abstract science there is, because you have to reason about things that you cannot see and you cannot feel. Okay. So, in order to be able to reason about things that you cannot see, you cannot touch, you cannot feel, that requires the ability to think in the abstract. And I think we developed that because of our traditional system. I'm not saying this is the only way to develop it, but and definitely other societies that don't have a tradition of meditation are also very good in mathematics. But I think that definitely for us in India, the whole notion of contemplation and meditation allows us to be good in mathematics. So I hope we continue to excel and maybe reach even greater heights than we did in the past.
Fantastic. Thank you very much. Okay, so let's see, are there any questions? Okay, one from Raja Ramji. So what would be, in your view, the Ayurvedic or Siddha interventions for boosting immunity, like haldi, milk doodh, kabasura, kashayam, that was used in Tamil Nadu, for example, as a way of reducing susceptible groups from getting infected? So Vidyasagar, is that something that you feel that you can answer?
Well, not very confidently, in the sense that it's very clear that susceptibility is not binary. In other words, it's not that you're susceptible or you're not. I mean, there is a scale between 0 and 1, and there are various things you can do to boost your immunity. And some of these time-tested methods, like drinking haldi milk and drinking kashayam, by the way, it's not used only in Tamil Nadu. I think it's used pretty much all over. They definitely do boost immunity in general. But it is not yet clear whether they boost the resistance to coronavirus per se, because controlled studies have not been done to ascertain that. So I'll hedge my answer by saying that yes, definitely immunity boosters have been a traditional part of our culture for thousands of years, even though we didn't call them immunity boosters. But whether they have a specific role to play in making people less vulnerable to COVID-19, I don't know that, and I'm not sure anybody else knows either.
Excellent. The only thing I would add is I remember looking into some of the properties of haldi, and particularly at any clinical trials evidence of its properties, of its impacts on health generally. This wasn't related to COVID-19. And there was remarkable evidence, for example, of it being quite impactful for people with Crohn's disease and other type of digestive diseases. So, there is actually a lot of truth, I feel, in the properties, the health benefits of these different concoctions that we know people in India are taking, that Ayush, the Department of Ayush, are promoting. So they certainly can't do any harm. And I think they are, as we were saying earlier, that if India has the highest recovery per infection, it could be that these sort of things are actually helping. And it'd be great to see some randomized control trials being done, being coordinated at a high level with scientists from different disciplines to collect the evidence to show the effectiveness of these different compounds, of these different foods, that sort of thing. So I say, there's definitely no harm, and given the thousands of years of tradition of people consuming these sorts of things, I would personally feel that it's very likely that it's more than just Crohn's disease that Haldi helps. It's going to be respiratory disease, in my opinion, but we need the evidence. Excellent. Okay, next question from Gavari Jatji. So who is your favorite Kerala School of mathematician, and why?
Unmute. Yeah, so before we get to this question from Garwale Jat, nice handle, by the way, I like it very much. I just want to say that when I say the highest recovery rate, it's not the highest recovery rate among 195 countries. Let's not, a lot of countries have very high recovery rates. Among major industrialized nations, among major economies, the top 10, 20, 30 largest economies in the world, we have the highest recovery rate. But if you go down the list, some of the African countries also have very high recovery rates. I just want to make that very clear so that someone doesn't misunderstand. In terms of who is the favorite Kerala school mathematician, I have to tell you honestly that I do not know which mathematician did what. What I mean by that is, I know collectively the contributions of the Kerala school mathematicians, but I have not gone sufficiently into detail to figure out which mathematician made which contribution. I mean, Madhava is the name we keep hearing very often. So presumably he was the most influential one of that era. But that is just second-hand knowledge, not first-hand knowledge from me.
Yeah, absolutely. I'd say Madhavaji is certainly the person who we know most about, who actually founded the school, and certainly who made discoveries of calculus that apparently people that traveled to the West, but nobody really could make head or tail of. People like Kepler, they saw his proofs, couldn't make head or tail of it. It was only Newton was the first Western scientist who could actually build upon it. So it just goes to show just how remarkable his discoveries were, that they flummoxed Western scientists for hundreds and hundreds of years. I mean, I guess one of the reasons why we probably struggle a bit with this question is because actually so little is known about these mathematicians. And it's so sad that, you've grown up in India, haven't you, Vidyasagar? And I'm sure in the science textbooks, the history textbooks, none of this was mentioned. You were only taught about Newton and Euler and people. So, and that's a very sad reflection on why we can't really answer this question too well. Great. Okay, next question, please. Okay. Okay, so a great social cultural aspect of Bharatiya society is the non-state dependent family-based model and the community-based response. It's also very important to be understood. I mean, Vidyasagar, did you take that into account in the models? I mean, or when because I know you've been doing modeling of the UK, are like cultural differences taken into account in the models yet, or is it grosser features that you're modeling only? Mute.
Oh, sorry. We did not take into account. There is a good reason for that. There have been some papers published in which people try to say that in different societies, the interaction pattern amongst people in different age brackets is different. So they were trying to say that can you figure out, looking at different societies, the rate at which old people interact with young people is very different. The rate at which old people interact with other old people is different. And this affects the rate at which the pandemic progresses. The trouble with those kinds of arguments is you can make those arguments at a very high level. They sound very philosophical and they sound very impressive. But then when you have to quantify them to make, remember the graph I showed you, it was not just a sketch. There were numbers, both horizontally and vertically. So there was time on the horizontal axis and the number of infections on the vertical axis. So those are what I call the quantitatively precise predictions. And if you try to make quantitative predictions, the difficulty you run into very quickly is that these models are too complicated and you do not have the ability to fit the models to data very accurately. So consequently, the predictions will be all over the place and they're not very reliable. So you can say, yes, what Mr. Muthukrishnan is saying is certainly correct, namely that the state independent family and community-based response played a very major role, no doubt about it. But that's just a very qualitative statement and not a quantitatively precise statement.
Fantastic, thank you. Okay. Oh, this is a big question from Abhimanyu. Okay, for both of us. So, how can Hindus survive when we are attacked at all levels? And I guess all levels you're saying, at the level of the media, at the level of the education system, at the level of individual churches and mosques, and so big question. I personally feel the greatest thing that we each can do is we need to be proud as that we are Hindus. We need to go out and proactively seek to know and learn about our history and to just understand the context in which current modern day India has come about, and particularly be critical when you are choosing which sources you are getting your information from, because if you put anything into Google, you'll be rest assured the first 10 pages worth of returns will be written by someone from a different faith or from a colonial mindset. So it can be really difficult to find the truth. But if you persevere, sometimes what I find useful is I know it sounds terrible, I go into Quora and you read down all the different responses, and there are many full of hate, of course, on any question you write about India in there, but you generally will find one, and that might then start your search into finding or being able to explore the correct literature. So that's what I tend to do. So then, yes, educate yourselves and do not be apologetic to ever be a Hindu, and particularly pass that trait on to any children or grandchildren. I think that's absolutely key to, again, be educating the youth and particularly making them feel proud and activated as Hindus, not to allow themselves to almost be like doormats who are feeling sorry for themselves for being Hindus and want to blend in with others and kind of reject them or disallow themselves to express their own identity. So there's a few aspects there that it's going out and searching for information and educating yourself, but it's also the psychological aspect of just saying, well, from now on, I'm going to be a proud Hindu, and imbibing that in every aspect of your life, and particularly in how you might be raising any children or grandchildren. And Vidyasagar, do you have anything more to add to that?
Well, the only thing I would tell the questioner is please change your handle name, because Abhimanyu, in fact, did not survive. So you probably want to choose a different name than that. But it's a very apt question, and I think Dr. Melissa answered it as well or better than I could have. So I will leave it like that. But I think the bigger issue is more awareness that we're being attacked, which probably was not there even 15, 20 years ago, or even 5 years ago. So that is some reason to hope. It won't help old people like me, but I hope the young people will take the fight to the next generation.
Absolutely. And in fact, I mean, just finishing off on that, particularly when it comes to, raising children, grandchildren, encouraging them to enter certain sort of strategic professions, such as to become, good quality pro-Hindu journalists and MPs and educationalists who have an ambition perhaps to change the syllabus. And if you do want to go into bureaucracy, then go into bureaucracy in order to instill change, not just to further your own career. Impassion them to create an India that they then want to raise children in who are proud Hindus. So we each individually need to be doing our bit. So that's an excellent question. Thank you very much, Abhimanyu-ji. Okay, another one from Rajaram-ji. Okay, so Japan and Taiwan did a great job with COVID-19 as well. Can you compare and contrast their approach with that of India? And I remember, actually, you mentioned that you've just been doing some modeling of Japan. Is that right, Vidyasagar?
Yeah. Yeah, we have not done Taiwan, but we have done Japan. And if you look at the situation in Japan, the conventional wisdom is that it is now spinning out of control. That's a bit of a stretch. It is not spinning out of control, but the number of cases is rising very rapidly. And in fact, it was Japan and Korea that forced us to look at our model. The model that you cited in your introduction, we called it SAIR2. It doesn't matter where that name comes from. And we figured out that model is not adequate. And then that led to the so-called Sutra model. And one of the important parameters in the Sutra model, there are 6 of them, 6 parameters. One of the parameters is what we call the reach. Okay. So the reach is basically a number between 0 and 1. It is what fraction of the society has had the opportunity to catch the disease, so to speak. So in other words, suppose you go back to the early days of the pandemic, a bunch of people come from abroad, you quarantine them in one place. They don't go out anywhere, so the total number of cases is contained. It looks like you've done a great job. But that's because the rest of society is not in the reach of this pandemic. So once these people are finally released from the quarantine, they start spreading out and they start spreading the disease through the society. So in India, the reach factor is close to 1. That's not a surprise, meaning there is no part of India that has been untouched by the pandemic. I don't mean everybody is sick. I mean that everyone has had an opportunity to catch the disease, if that makes any sense to you. So why am I giving this long-winded answer? In the case of Japan, you can show that the reach has been very small. So the number of cases being so low in Japan was really a reflection of the fact that the average Japanese did not really come into contact with the disease to the extent that has happened in India. But it's a bit like a pressure cooker. I mean, you can put the top on the pressure cooker for a while, but eventually it will explode. And that is what is happening in Japan. I'm not taking anything away from Japan, but I would like to tell Mr. Rajaram to please go to any website that lists total number of cases, and he would see that there's a very sharp rise in cases in Japan in the last little while. So they have the classic 2 peak syndrome. They thought they had the disease under control, but then now it's going back up again. And we can explain this by the fact that the reach is increasing. That means the pandemic is now affecting a larger part of the population. And basically, the one message that the people listening should take away is, until the reach is approximately equal to 1, meaning practically everyone who could have caught the disease is either caught it or is immune to it, you cannot ever declare the pandemic is over. Now, this particular topic is very close to the heart of our committee, because whenever we stand up and say, look, the pandemic in India is on its way down, we don't have to worry. Somebody says, well, look at Japan, look at UK, look at US. In all these cases, the reach is actually not close to 1. Even the UK, according to our model, the reach used to be around 0.3, and now it is around 0.5. So it means the UK has a long way to go as per our model. Okay, but the type of question that Mr. Rajaram asked did a very useful service to us, because we as the modelers were forced to figure out how can one model explain two very different sets of responses and two very different sets of trajectories. The Indian one goes like this and comes down, goes like this and comes down, and Japan, UK are going like this. Italy is even having a triple hump. And within India, by the way, if you look at the national capital region, Delhi, it has got a triple hump as well. So we did not want to do a lot of handcrafting. We just wanted one model with a suitable choice of parameters can explain all the different types of behaviors. So to summarize that long answer in one sentence, Japan did a great job till now, but they are going to have one more peak. And we don't have enough data yet to predict comfortably and confidently how large that peak will be. Japan, by the way, conducted very few tests compared with India. So you can just look at this website that give you a number of tests per million population. You will see Japan is very low. So they probably have a lot more asymptomatic, undetected cases compared with India. So that's what is kind of bubbling up now and creating the second wave of the pandemic there.
Very interesting. Thank you. Okay, so question from Aditya G. So do you think reforming the Indian education system to recognize Aryabhatta rather than Pythagoras is more important than economic and defense reform? So personally, I do think so, because reforming the education system will filter down to other reforms, and will have such an impact on the confidence, the pride of Indians generally, and particularly Hindus, who then go on, who are, who have jobs in the economy and in defense. So education really is, in many ways, the core thing I feel that needs to be reformed in order for change to ripple out throughout the country, and to actually then move people and policies from a colonial mindset to a Bharatiya mindset in all aspects of life, because the Vedic tradition, it was so comprehensive. It touched on the economy, it touched on the approach to defense and all aspects of life. So India has such a wealth and tradition in how to live your life and how society should operate. And it's so sad at the moment that it's currently operating based on colonial rules. So in order for it to realize its potential, you need to first change the mindset of Bharatiyas, and in order to do that, you need to target the education system. So Vidyasagar ji, do you have anything more to add to that?
Well, I think the question is suggesting that it is either or. It seems to be implying that if you reform the Indian education system, you cannot reform the defense and economics. Well, it's not either or. You can do all of these things. And actually, from a cost-benefit standpoint, reforming the education system costs next to nothing. In fact, one of my biggest disappointments with the the BJP government in the first term and in the second term has been that they have done nothing to reform our education system. They even brag about it, not something I would have done. So I think the question itself is based on a wrong premise that one thing is somehow at the cost of the other. I don't see it that way. I think we have to take a holistic approach, and certainly reforming the education system will not prevent you from carrying out economic and defense reforms. That's my view.
Very good point. Yes, about just how cheaply the education system could be reformed. Absolutely. Yeah. Okay, next question. Again from Kavali Chatji. So how was my experience in India during the pandemic? You said you took the last flight out. Yes, so as I mentioned at the very beginning, right at the beginning of this session, I explained how I was in India so for the holy period. So at the beginning of March through till basically the lockdown, and we were very fortunate, I guess, in that, or maybe very unfortunate at the same time, but we were fortunate in that we changed our flights very last minute, and we just kind of looked in the calendar and we, so Wednesday, we'll go for Wednesday. So we changed it to Wednesday, and as it happened, it was the very last flight out back to the UK. So that was fortunate. But at the same time, it was unfortunate because I was sad to be leaving Bharat so quickly, because we'd only arrived about a week earlier, so we didn't get to see much of India that we had planned to see. So that was very sad. But my experiences were that India had been called into action so quickly. I remember, so as we were flying out those last few days, all of the hotels were checking our temperature. They were handing out, giving us masks, and we had to wear them. At the airport, they checked our temperature. There were public sort of safety notices around, giving advice on social distancing, and also actually, I think they were produced by the Department of Ayush. It was even there they were advising things like haldi and just really concrete things, which was just in so stark contrast when we landed back in London at Heathrow Airport, where I feel it's so crazy reflecting on it now, but the airport website itself said, "We do not recommend you wear a mask." So, I mean, there was no harm in wearing a mask, but they were actually saying you shouldn't wear a mask. But we wore a mask because we were coming from India on a flight full of Indians who were all wearing masks. But then when we landed and we were walking through the airport, we were the only people wearing masks. And, at that time, there was, yes, maybe very little evidence for the effectiveness of masks. But the issue is that psychologically, I felt, even if the masks are allowing droplets to still enter my nose and mouth, the fact that I'm wearing a mask is going to change my approach to how I move around. Because when you're wearing a mask, subconsciously, you're not going to go around touching, the hand railing so much. You're not going to touch your face so often. So I felt there's no harm in this. So we were wearing masks, certainly. And it's just interesting how long it took for the UK to accept that there was some benefit of wearing masks. Like literally, I don't know the exact number, but it was like 4 or 5 months until suddenly the government said, actually, let's take a U-turn here. We advise you to wear a mask. So I felt that overall, in the UK, they were always waiting for the scientific evidence, even when the common sense was there in front of them. They'd have to wait for the scientific evidence before they said anything or made any recommendations. And that's one of the reasons then why they've had to do so many U-turns and have had to make so many rapid decisions and counter decisions that in conflict with what they said the day before, because until they had the evidence before them, they would take one tack and then and then they would go around and take the U-turn, and that just created such confusion in the minds of people that even when they started advising people to wear masks like 4 or 5 months later, it took pretty much, I would say, until around now for people to actually be, everyone really to be wearing masks. It's taken about 10 months essentially for that change to happen. And now people are much more savvy to wearing masks. Everyone in the shops are wearing them. And even as you're walking out and about, in some places, people are wearing masks, or they will try and walk around you. But even, you know, a few months ago, they really weren't. And I think it's just, again, it's just another example of the poor management of coronavirus in the UK, as sort of like a social cultural level, and the way that the MPs have been speaking to the people and just not been able to get the people on board. And that's why perhaps we're in this terrible situation now, where a major incident has been declared in many places in the UK. And apparently, as I mentioned at the beginning, 1 in 15 people in some areas of London apparently are considered, they think they have coronavirus. 1 in 15, where we are, I think it's about 1 in 40, 1 in 35, 1 in 40 they predict. So yeah, not good times at all. So yes, thank you, very good question, Guhari Jatji.
Would your audience be interested in seeing the situation in Japan? Because somebody asked a question about that.
Sure, yeah, yeah, absolutely.
I'll show you that.
It might even be interesting, I'm thinking, because I remember you mentioning that you've done some modelling on the UK, you know, the impacts of that in India perhaps as well.
For India also. So these are the predictions for Japan. I'm sorry, the slide is, you should have said Japan, and we're going to fix that. But anyway, you just have to take my word for it. This is actually our predictions for Japan. Now, don't take this peak very seriously, because you see, this is just a few days data, and therefore our prediction is not at all reliable. But the fact of the matter is that there have been 2 previous peaks in Japan, and in each peak, the Japanese thought that the pandemic was over. Okay. Now, this last peak has come as a very nasty surprise to them. Okay. So the number of cases in absolute numbers very small, just 35,000 cases in all, compared with about we have at the moment in India around 2 lakhs active cases, but compared with what they had earlier, 10,000, 15,000 cases, these very large numbers have come as a nasty surprise to them. It will peak as per the saffron curve, but we don't yet stand behind this number, because this data is too sketchy and too recent, and therefore, anyway, my point is that it is going up, it will continue to go up, and it will bend down, probably sometime near the end of this month. But when we have a little more data from Japan, we will revisit this curve and we'll have a lot more confidence in that figure. And since we talked about UK, let me just show you UK. Now, so this is our prediction for the UK. We are a little bit more confident of this prediction because this wave is much longer than it was in Japan. I hope I'm making the point. The more data you have, the more confidence you have. So I think people living in the UK will be pleased to note that as per our predictions, the peak is reasonably close at hand. Okay. But this is detected new infections, and you can see it's already out of date, because this work was done about 10 days ago. And we thought that the peak would be around 40,000 new infections per day. And already the UK has passed 60,000. So we have to recalibrate this data. But the thing is that again, you see the same phenomenon. The first peak goes down, everybody starts celebrating and thinking that the pandemic is over. Then there's the second peak, it's higher, but it goes down. People are again in a celebratory mode. Now comes the third peak, and we're not even at the peak yet. So I think that, I will share this figure with you later when we recalibrate everything, because as I said, this is not reliable anymore. But definitely a third wave is on the cards for the UK, with probably quite high. And I hope I should have mentioned it. For Japan, those numbers were active infections, 30,000 active infections. But in the UK, as I mentioned earlier, they do not report recoveries. So this is 40, 50, 60,000 daily new cases. So it's much worse in the UK.
Yeah.
Even though UK is half the population of Japan, the situation in UK is much, much worse in terms of the pandemic.
And that UK model is taking into account that I think it's about 80% of the new infections are with this mutated version, which is more virulent.
Well, it's not very clear in the sense that you see in India, what we have done is whenever a passenger comes from the UK, so now all Indian airport, if you come off the plane, you basically have two choices. You spend 2 weeks in quarantine, or you take an RT-PCR test right at the airport. And the RT-PCR test takes about 4 hours. So you sit in some lounge, entertain yourself, and at the end of 4 hours, if your test is negative, you go. And if your test is positive, then you have to be in quarantine outside the airport. That's what was happening earlier. Now what is being done for UK returned patients is, if they test positive, the saliva sample, or to be more accurate, the mRNA, the RNA sample, is being sent to one of two places, either the CCMB, Center for Cellular and Molecular Biology in Hyderabad here, or to the IGIB in Delhi. So what is happening is that these samples from UK returned corona positive patient is being sequenced to determine whether they have the new variant or they do not have the new variant. Okay. Now the problem in the UK data that I see is, I do not know whether this very large scale sequencing is taking place. In other words, when you see that yesterday there were 60,000 new patients, okay, what fraction of them had the new mutation? If you don't have that kind of information, how can you possibly model it? It's quite wrong to think that all these people have the new mutation, because they don't. It is equally wrong to think that none of them has it. So if you want to do modeling and also take into account the fact that the new mutation spreads relatively more quickly, you have to have a breakup. So it's not enough to say this many people got sick. You have to invest the money to sequence the virus extracted from the new patients. And you don't have to sequence all 60,000. You can use sampling techniques. But you still have to make an accurate estimate of what fraction of the new cases are carrying the new virus. And that information is just not available in the UK. And interestingly, it will be available in India, because all the UK returnees who are testing positive are being sequenced in India.
Excellent. Another example of, a success story in India, maybe compared to what's been happening in the UK, the transparency, the collection of data, that sort of thing. I think we've got time for one more question. Is there one more question before we close? Okay, so finally from Rajaram G, one of the most important markers of what constitutes dharma is socha, or orderly hygienic living. The importance of this has been underscored in this pandemic. Vidyasagar ji, did you want to comment on this one?
I think I keep getting muted. All right. I certainly agree with the questioner on that. People were making the comment that in the traditional Indian way of greeting each other, we tend to keep social distance in any case. I mean, the way in which Westerners used to greet each other pre-pandemic, was very different compared with the way in which Indians live. And the Shaucha is certainly a very, very important concept. I hope if people realize, as a consequence of all of these things that have happened, that the ancients actually thought very deeply about all these matters. I mean, it's not possible that all these things are purely by accident. They would have done their own experimentation and arrived at this conclusion that this is the way to do things. And I think that simply dismissing them in search of some very elusive modernity is not at all the right thing to do.
Absolutely. And one thing I'll add to that is that I was reading that some of the ancient cities in India, thousands of years old, very sophisticated cities, had also sophisticated sort of sewerage systems. And compare that to in the West, where people were living basically in huts until actually relatively recently. And even then, within London, for example, a few hundreds of years ago, the way they would get rid of their toilet waste is they'd throw it out of the window. So you're right in this question that there's always been a tradition of hygiene. There must have been such a great knowledge. And I'm sure I remember reading that, things like microbes and bacteria, some of the Shastras, they actually talk about some of these, fundamental organisms. So there must have been such a knowledge. And it's just so sad that so few of us know what is actually written about it in the Shastras. And what many people know has been manipulated because it's not been translated out of Sanskrit very well. Yeah. Okay, sorry, one more question. One last question. Okay. No. Would it be safe to get vaccinated? And would it be safe for the elderly population who are diabetic and have blood pressure problems? Okay, so okay. You'll go first.
No, because since the questioner explicitly mentions elderly people who are diabetic and have BP problem, I meet all those criteria. I'm old, I have diabetes, and as a consequence of diabetes, I have BP. So I don't think that once the Indian regulatory authorities approve the vaccine, I would have any hesitation about that. And I don't know if I told you that I actually got corona in the month of July. I was in the hospital for 9 days, and 8 of those 9 days I was on supplementary oxygen to aid my breathing. So I've been through the worst of it. So for me, the risk factor was getting the corona because I'm old and because I'm diabetic and because I have a BP problem. So after going through all that, I would say the vaccine is going to be a breeze. That's my reaction. Of course, it has to be a vaccine that is certified safe by our Indian regulatory authorities. But I have full confidence that they will not cut any corners. So once they say it's safe, it's safe.
Excellent, very well answered. Thank you very much, Vidyasagar. I think we'll be closing it there. So that was a really fascinating venture into COVID-19 in the UK and in India, the modeling, the social, cultural impacts and factors into how the experience has been in the two countries, and just more generally about some of the civilizational issues that India is facing, not just in COVID-19 times, but in the education system and recognizing its scientists, its mathematicians. So all I can do is thank you so much for joining us. And also thank our fantastic audience for your fantastic questions. And I look forward to speaking with you again soon, everyone. Okay. Namaste, everyone. Dhanyavad.
Namaste, and thank you for giving me the opportunity.
Jai Shri Ram.